Right. So the most common injuries what we find in the badminton athletes are the shoulder instabilities. The shoulder instabilities are the domain where the shoulder has been used over a vigorous number of time for the overhead movements. And these are the factors which needs to be encountered first when the pain comes to an athlete. If an athlete reports to you with any kind of non-traumatic shoulder pain, it's basically the instability which has caused over a repeated number of times. Now, the instability could be because of overuse, or it could be because of any kind of faulty biomechanics, or it could be any kind of involuntary movement patterns. Now, the involuntary movement patterns is something where the athlete's body, the proprioception is lost in the shoulder and he just completes the movement. So these are the three major things where an instability can be caused in an overhead athlete, and it could be painful initially, and if you continue to do with the instability, the pain can become more worse. So it's really important for us to first tackle the instability which has been caused due to overuse, due to faulty biomechanics, and due to involuntary movement patterns. So the instabilities can also be dealt with either your workload management. Now, the workload management can be more categorized into acute workload management and chronic workload management. So, whenever an athlete reports to you with any kind of non-traumatic shoulder pain and you doubt it could be an instability, then we see all these domains where it could be responsible for an unstable shoulder. Coming to the diagnosis, it could be either an anterior instability, could be a posterior, which is quite rare, and could be inferior, which is again much rarer. So when all these three factors club together because of overuse, this will go for multi-directional instability, and that's really where the athlete comes to you with pain. That's where exactly where athlete comes to you. It reports to you, sir, I have got pain in my shoulder because of repeated overhead movements, non-traumatic movements, which needs to be encountered either via correcting the faulty biomechanics or involuntary movement patterns, or needs to stop the overuse, or needs to have a good look over the workload management, whether it's an acute, what I meant by acute is over a period of 1 week, where we monitor the workload in badminton players, could be more than 4 weeks, where again we monitor the workload for the badminton players. It includes training as well as the skill practice. So this workload should be in a sweet spot where it shouldn't exceed more than 1.3. It should be between 0.8 to 1.3, and that is where we say that's the sweet spot for any athlete. If it exceeds more than 1.5, then that's the damaging part. That's a little bit risky, where I don't want my athlete to land it over there. So whenever I go for a workload management, I'll just look like in 1 week what's the acute chronic workload ratio, that's called as ACWR ratio. That is the acute chronic workload ratio, overuse, involuntary movement patterns, faulty biomechanics, leading up to shoulder instabilities, then multi-directional instabilities, and then coming to the physio. So it's better like if you tackle all these things initially during your MSK assessments and deal it with the SNC, and these problems won't bother you again.